Hi, my name is Philip Smith. I'm the Simulation Center Coordinator here at Kettering College for the IPE Simulation Center. This is SimMan, and SimMan is what we call a high fidelity simulator. And we call it that because although it's plastic, we can mimic just about any kind of human pathology that we know of. So we can make this patient bleed, we can give this patient cardiac arrest, respiratory arrest, any other kind of ailment that we need to train our nurses on. We can make this mannequin do that. You can start IVs on this mannequin. You can listen to chest sounds, heart tones, bowel sounds. This mannequin has sounds in the front and the back, which a lot of the older mannequins only have sounds in the front. This mannequin has pulses in the radial pulses, carotid pulses, pedal pulses in the feet. You can check a femoral pulse on this mannequin. And when we use these mannequins, we actually have our instructors sit in the back watching on a monitor, and they wear a gaming headset. And so when you ask this patient a question, the instructor in the back can actually hear the question and respond appropriately with the appropriate answers that advance that scenario that you're working with today. A lot of the information that you'll use in your scenarios you'll get through our touchscreen monitors. These are set up in connection with the mannequin, and they are interactive, so if you want to get a particular waveform, you can just touch it and it'll give you that information that you need for that scenario. If you need a blood pressure, you can just start the blood pressure and it'll go through the process of mimicking what it actually sounds like and the time it takes to actually get a blood pressure on a patient. Things that Annie does. Annie can sit up on her own. We can sit her in a sitting position so that our students can evaluate her back, listen to her lung sounds on the back. She can sit on the edge of the bed, so that's an important tool when you're assessing a patient. And this way the nursing students can practice a good quality nursing assessment before they go out into the field to do their clinicals and then to later work as a nurse. This is our Sim Newbie. This is a baby simulator that simulates. It's actually supposed to be a newbie, but the size of it is probably more appropriate for an infant. So, but we do all sorts of scenarios with this patient. We can do CPR on this baby. The baby moves on its own. We can simulate seizures. We can simulate cardiac arrest, respiratory arrest, and we can practice all those scenarios that no one ever wants to do in real life. Here we are in the control room. This is where the instructors go to observe what happens in the patient care area. As you can see, our instructor has on a gaming headset, and everything the instructor says comes through the mannequin. So when you're in the room caring for the patient, you practice interviewing the patient as you would a real person. When you ask the patient a question, the instructor responds appropriately for the scenario that you're in the process of caring for. Everything that you say in the patient care area and everything that you do in the patient area is observable by the people sitting here at this monitor. And we can do up to 12 simulations at the same time.